Good afternoon, everyone, and welcome to the Samuel Merritt webinar, where we're going to be talking about navigating the VA healthcare system. We are so excited that you guys are joining us today. We have an agenda filled with lots of really great resources and information. And we're going to start with Bridget Leach, who is the Student Veteran Health Program. She works with the Student Veteran Health Program at the SFVA. She's going to be talking to you guys all about navigating the veteran healthcare system. And then I'm going to come back on and I'm going to talk to you guys about benefits and resources that CalVet offers and how to access them, where to find information on them. We also have Kevin Graves, who is one of our local interagency network coordinators that works at CalVet. He's going to talk about everything that the links do. And then we're going to have some time at the end to answer some questions. So before we go ahead and get started, I have a couple quick housekeeping things to go over. This webinar is being recorded. You all heard that just a couple minutes ago. And staying on this webinar means that you do consent to that. If for any reason you need to leave or for some reason you get kicked off for any reason, just use that same link that you started on today and join us right back on. My colleague Michael is going to be putting lots of really great information in the chat field. So you won't be able to utilize the chat tab or the chat field that you see. But if you have any questions at all, use the Q&A tab. You can ask questions directly there. However, if you do have a question related to your personal scenario, you are able to contact Bridget, who is our presenter about all things veteran related. You can contact her directly, and you're going to find her contact information after her presentation. In fact, you're going to find all of our contact information after everyone speaks and presents. And then at the very end of the webinar, you're going to see a screen that has all of our contact information. That way you can capture that if needed. We'll go ahead and get going. So I'm going to go ahead and bring Bridget right on. And whenever you're ready, Bridget.
Thank you so much, Jana. For some reason, I think the video is taking a little while to come up, but hopefully that's coming up okay.
Sure, of course.
Great. Can you guys see me and hear me okay?
I sure can.
Thank you so much, Jana. I really appreciate it.
Of course.
And always appreciate being able to do this with you guys. Yeah, so I'm a social worker from the San Francisco VA, and I'm the coordinator of our Student Veteran Health Program, specifically over at City College of San Francisco and Skyline College, and also for Golden Gate University, but we cover a number of schools across the Bay Area. And all the way up to the Oregon border. My colleague Forrest up at in Eureka covers College of the Redwoods and Cal Poly Humboldt. And I'm really fortunate today to be able to do this presentation for Samuel Merritt University as well. So maybe we can go ahead to the next slide. Wonderful. Thank you so much. So one of the things that I think we like to talk about when we're talking about VA healthcare and navigating the VA healthcare system is kind of this understanding, I think, that we all have, right? That navigating VA healthcare can be a tricky thing to do. We don't have a navigating VA healthcare presentation for nothing. It can be hard to know where to start, where to get connected. And this is really true of all VA benefits. But I'm speaking more specifically about the healthcare system today. But we really love this particular quote. So we kind of started putting this into some of our presentations, kind of this idea that, there's this magical world of resources out there, but there's this kind of question, of how do you get to them, right? What door do you go through? What number do you call? And so we like to kind of have this idea that there's really kind of a no wrong door policy, at least at the San Francisco VA and with our Student Veteran Health Program. And we're always really happy to help. It's really a large part of why our our program, our student veteran health program, came into being. Because the VA, I think, tends to get a bad rap, right? But it's really an excellent benefit that a lot of veterans you have earned. And there's some great providers at the VA and services at the VA. And so we always hate to have people throw the baby out with the bathwater and not even start the process or get connected when there really is, this incredible kind of, wealth of resources out there, and great providers and everything. So maybe we can go on to the next slide. Thank you so much. So one of the things that we also like to do when we're talking about VA healthcare is also kind of make sure it's really clear that there are three branches of the VA. So there's actually three administrations, and it's very often times that we find that folks get really confused about these three different branches, right? So we have the Veterans Health Administration branch, and that's the branch that I work for. And the way that I tend to think about the Veterans Health Administration is it's anything really involving treatment and care. So medical care, mental health care, clinics and hospitals across the country. Getting a VA ID card is usually through your healthcare system, the Veterans Health Administration. And then there's the Veterans Benefits Administration on the other side. And the VBA, the way that I tend to think about the VBA is really with the word benefits in it, anything involving kind of a monetary payment, right? So service connection disability payments, also GI Bill, right? Or VRNE benefits that you're receiving a monthly amount, depending on whether you are having a service connection disability rating or if you're going to school or using those benefits while you're in school. And then home loans, things like that. So those are the two branches that I feel like we tend to work with the most, or that come up the most when I'm talking to young student veterans and probably in general. And they're oftentimes kind of confused and interchanged. So a lot of times I'll ask folks, are you enrolled in VA healthcare? And they'll say, oh, yes, I have a service connection disability rating of 20% or whatever it may be. And really, those are two separate branches, right? It's possible that you have VA healthcare, but it's also possible that you have a service connection disability rating and you don't have VA healthcare. So I always like to make that distinction so folks are aware of that. There is also a third branch of the VA, which is the National Cemetery Administration, and hopefully it'll be many years before you need to worry about that. But it's good to know that those benefits are out there as well. And one of the other organizations that we really like to plug as well and kind of make sure that folks are aware of, even though the County Veteran Service offices are not part of the VA, they're not branches of the VA, they're run out of kind of the local cities and counties. However, we work with them quite often and they interface with all three branches. So they're really one of the best, I think, resources for helping folks get connected with service connection disabilities at no cost. They can do a benefits review. So if you're not really sure what benefits you're eligible for, they're an excellent resource for that, as well as many other kind of benefits as well. And they interact with both us at the Veterans Health Administration, as well as the Veterans Benefits Administration, as well as the National Cemetery Administration as well. So I think we can go on to the next slide if that is okay, great. So a lot of times we like to start with kind of a bird's eye view, right? When we're talking about VA healthcare, once you enroll, you're enrolling into a national healthcare system, right? So you only need to enroll in the VA once, actually, and then you can register in additional medical centers across the country. And so when you're thinking about it, for example, folks that might be in the Oakland area, if you're going to school in Samuel Merritt, for example, and you get enrolled in Oakland, which is part of the San Francisco VA healthcare system. Maybe that's where you initially enroll, but maybe you actually enrolled originally when you were in New York, for example, in New York City, or you're living somewhere across the country, and then you move here. And one of the things that I do recommend is if you are going to school in a different part of the country or different medical center area than where you originally enrolled, even if it's a different place from where you're living, because we know student veterans commute quite large distances or long distances to get to school sometimes. It's really important to be enrolled and registered in your local medical center where you're going to school. Just God forbid something happens, when you go to the emergency room, you don't have to worry about fill out a form. We can always help you very much with that, particularly the San Francisco VA, but we can also get you connected with other VAs across the country for assistance with that. Also good to know, right, that there is also VA care in Guam, American Samoa, Puerto Rico, as well as in the Philippines. The eligibility criteria is a little bit different for the Philippines. I think you have to have a service connection, service connected disability of 0% or higher, or live in the Philippines as well to be eligible. But it's really good to know that it is a nationwide system of healthcare, which is a wonderful benefit, I think, to the VA. So maybe if we could move to the next slide, please. Wonderful, thanks so much. So when we're looking at a little bit closer to home, at least for myself, as sometimes folks are listening to these webinars from across the state, but at least when we're looking at the Bay Area in particular, there's 3 major medical centers and healthcare systems in a fairly close area. So we might find sometimes that folks are enrolled in the Northern California VA, the Palo Alto VA, and the San Francisco VA. And it's good to know that those emergency rooms are accessible 24/7, right? So the San Francisco VA, the hub is in at Fort Miley, they call it, in the San Francisco 42nd Avenue and Clement Street. The Northern California VA emergency rooms in Sacramento and Mather, and the Palo Alto VA, their emergency room is in Palo Alto. Another kind of note, in addition to kind of the recommendation we would make to get registered in your local VA where you're taking classes, even if you keep your primary care at whatever VA you're actually attending or where you live, where you reside, it's you can also just use kind of the emergency room at any VA across the country. The other thing to know too, San Francisco does have what I like to call kind of a la carte services. So certain particular services that you may be able to receive, such as like audiology, podiatry, nutrition, things like that, as well as optometry, that you can actually go to the San Francisco VA without a primary care referral for those particular services. So that's also a good thing to be aware of as well. And I think we can go to the next slide. Thank you so much. So now we're going to get into eligibility for VA healthcare. So I added this slide in particular because in this meme that says, see, it's simple, because it can be a bit of a complicated process. But I wanted, before we kind of dive into the specifics of eligibility, I think it's really important to know for any benefit through the VA that really there's different factors that are taken into account, right? So there's things like if you have a disability rating, that's something that's factored in. If you like different aspects of your service history, right? So did you serve in combat, for example, or what period of time did you serve in? Was it before 1980, after 1980? A number of different kind of pieces with that, also kind of involving your discharge type as well. If it's an honorable discharge versus an other than honorable, or a general versus a dishonorable, all of those things can kind of impact your eligibility, as well as sometimes your income level as well. So those, I would say, are the 3 main factors that are really looked at when we're talking about veterans VA healthcare in particular. It's also good to know, so for example, let's say you're not eligible for VA healthcare maybe because your income is too high and you don't have something else that kind of waives that income, for example, like a service connection disability rating, for example. You can actually work with your local CVSO to help you file for service connection claims, and that actually will then make you eligible for VA healthcare potentially. The other piece too, for folks that may have kind of a discharge type that isn't honorable or isn't kind of general, I would say it's about a 50-50 chance, if you have an other than honorable or a general discharge, that you'd be eligible for VA healthcare. So if you need to do, or if you have a dishonorable discharge, you can actually work with a local organization called Swords to Plowshares is great at helping folks to be able to work on doing a discharge upgrade or a character of service upgrade as well. And I also have my contact information at the end of this slide too, that if you have any questions, you're more than welcome to reach out. If you're just not sure if you're eligible, or you want to be able to just talk to someone a little bit more about that piece, or or anyone on my team is more than happy to help you with that. The other thing too that I think is really important when we're talking about VA healthcare, it's really important to come away with, I think, three major pieces. You want to know if you're eligible for VA healthcare. If you're not, what you might need to be able to do to become eligible. And the third thing is, if there are kind of different pieces that as far as, so I think, sorry, if you're eligible is question number one. Two is if you're not eligible, why not? So I lumped one and two together. And it's also good to have that actually double checked, because I've had folks that have been turned down by their local member services or eligibility office, and it's actually not been correct. So it's pretty good to get it in writing and or kind of talk to a supervisor or one of us to kind of double check that. And then again, the third one would be if you're not currently eligible, what your options would be to become eligible. Okay, next slide. Thanks so much. So this is kind of where we get into a little bit of the nitty gritty, right? So this is where, kind of similar to some people's relationship status, right, it can be complicated. So one of the things that I think is important to know, if this slide, just looking at it becomes overwhelming, please don't worry too much. Please reach out. We're always happy to help you file an application, go through the application process with you. And or the other thing you can always do is just apply and just kind of see what happens. That's certainly another option. But I would say the cases that are a little bit more simpler, I think a lot of times I really encourage student veterans to enroll in VA healthcare because you are typically eligible, because your income is usually not too high. The GI Bill is not something that's counted towards your income. And so that is usually for folks that are coming in and going to school and using benefits. Usually they have had at least 2 years active duty, an honorable discharge, and usually your income is below the local threshold for the area that you're living. Also, if you have a service connection disability rating or your recent combat vet, those are things that may actually waive those income requirements. It's a little bit different if you're a reservist or in the National Guard. So you don't have to have actually served for 2 years active duty. However, you do have to have been activated by a federal order. I think that's a Title 10 order, if I'm not mistaken. Usually that's on your DD 214. And usually having served the full course of that deployment. And then also sometimes there's some income thresholds as well. But again, if you have a service connection disability rating, that's kind of another way around. And it does also speak here about some of the other eligibility scenarios that might come up. Right, so if you have a service connection disability of 10% or higher, if you were also, I think a really important thing to be aware of now after the PACT Act is that there are, I feel like, increasingly kind of they're expanding eligibility for an increasing number of veterans that were exposed to burn pits and other toxic substances. So that's another thing that's also important to know as well. Okay, I think we can go on to the next slide. Thank you so much. So when I mentioned that piece, you might have kind of caught that it might depend actually on the county where you reside. So let's say you have an honorable discharge, you have served over 2 years of active duty, but let's say your income is a little bit higher and you don't have a service connection disability rating yet. This is where it's kind of helpful we put together this chart to kind of look a little bit more closely at, based on the county where you're residing, and that's the address that you'd be putting on your application as your residential address. These are the thresholds that we're looking at. So, and they really vary from area to area. So for example, for San Francisco, San Mateo, and Marin, the threshold's pretty high. For a single veteran, it's $114,000, 510. And if you're in Alameda County in Contra Costa, it kind of bumps down to $86,405. Now that's for a single veteran. If you have dependents, it usually kind of bumps up about 10,000 per dependent. So that is also something that's important to keep in mind. But also, like, let's say if you look at some of the other areas, like Stanislaus, Modesto County, for example, that actually kind of bumps down to 51,975. So it really depends on what area you're actually living in. That can make a huge difference sometimes if you don't have a service connection disability rating. But I think we can move on. If folks have questions, I'm always happy to answer those later. Thank you so much. So this particular slide, one of the things I think that people sometimes that we come across a lot is kind of with young student veterans, it's like, oh, I'm healthy, I'm good, I don't need health care. And so this idea of kind of why should you enroll, right? You want to make sure you have health insurance. This is something that you have earned. There's not really a lot of reasons I would say not to apply, but there's definitely a lot of reasons why you should. And one of the things is like, God forbid something happens and you have an emergency. I added this meme in here that's like, Dawson saying, I had to go to the hospital without health insurance, and where am I going to get $20,000? And unfortunately, with healthcare in the United States right now, I mean, that is, oftentimes it might be closer to $200,000 or more. So a medical emergency when you don't have health insurance can really be pretty devastating financially and really can upend so many different things in your life when it doesn't need to if you're eligible for VA healthcare, right? And as far as VA healthcare, as far as healthcare these days in our country in particular, it's actually pretty reasonable, right? This is also, again, something that you've earned. The other thing too is that, the providers at the VA are, very experienced in working with veterans. So it's a very veteran-centric healthcare system. So they're very used to kind of treating veterans. They know kind of what issues are specific to veterans and treatments and specialty services and research studies and things like that. So definitely good to be aware of. Also, there's no enrollment charge. There's no monthly charge. There's no yearly charge. It's pretty low fee for healthcare these days, right? I'll be kind of illustrating this on other slides as far as the co-pays. The other thing is once you're enrolled in VA healthcare, you have it for life, right? So the other thing is too, if you are employed and then you switch jobs, right? This is kind of one of the things that's a huge issue, I think, for many Americans when you are in a situation where your healthcare is tied to your job and you feel like you can't change jobs because you don't have healthcare. This is one of these things that allows you some freedom to be able to know that you're going to be covered. Even if you use other healthcare, you have it as a backup. And it also, if your income increases, even though if you're a student now, for example, but then all of a sudden your income goes above those thresholds, you're grandfathered in. So as long as you enroll below those thresholds, you're actually good to go. So maybe what we can do is just keep going to the next slide. Thank you so much. So other reasons, I'd like to say that this is not your father's, your grandfather's, mother's or grandmother's VA, right? So there's a lot of great services that are available through the VA, and you don't really know about them until you get connected. Sometimes you don't even know 100% if you're connected. I feel like we always talk to other providers and we're like, oh, you're doing that? That's so cool. And we learn about things. The only way to really learn is actually to get connected with the system. There's whole health services, and I kind of listed a whole bunch of the different whole health services offered through the VA. Also, I love to plug, I think Dennis may be potentially on the joining us today, might be as a participant, listening in perchance. I always love to plug his group as well. He does a Pause for Purple Hearts group that's just a wonderful group where you're training service animals and socializing them, oftentimes puppies, to be able to then have these dogs be able to go and become service animals for other veterans. So it's a really lovely group. And for some folks, the traditional therapy may not be the thing that works, but maybe kind of also, working with animals is kind of a huge kind of other piece to being able to, I think, sometimes heal yourself and heal others, and also to be of service to these service animals as well as other vets. So maybe we can go to the next slide. Wonderful. Thank you so much. So as far as, it's VA healthcare, it's comprehensive healthcare. I like to say it's like head to toe coverage, except for teeth. You have to be 100% service connected technically to be eligible for VA dental. However, there is a VA dental insurance program that you're eligible for, which is kind of subsidized by the VA through Delta Dental and MetLife if you are enrolled in VA healthcare. There's primary care, preventive care, mental health specialty services. I think I mentioned previously some of the a la carte services, optometry, audiology, nutrition. And on the previous slide, it talked a little bit about some of the whole health options, as well as acupuncture, chiropractic care. There's an excellent pain clinic at the San Francisco VA. There's a number of other services that are just really, I've been so impressed with. Also emergency care. You can go to the emergency room 24/7 for medical or mental health emergencies, and you can use it like urgent care as well. So maybe what I'll do to just make sure we get through the slides, I'll go to the next one if that would be okay. Thank you so much. So I mentioned this, I think, briefly before. So as far as co-payments, for most veterans that are paying for co-payments, not all veterans do actually have to pay for co-payments. So I believe if you're 10% service connected or higher, you actually are waived from a number of the different co-payments. But let's say you're 0% service connected, or you're a non-service connected veteran, you may have to pay, but it's, as far as healthcare these days, it's pretty reasonable. It's $15 for primary or basic care services and $50 for specialty services. One note, however, if you do lump all your appointments on the same day, you're only going to get charged for one co-payment. So that's a helpful trick to know about, or a tip. We can go to the next slide. Thank you so much. So as far as costs for prescriptions, this is also incredibly reasonable. I've met with a number of veterans that, even if they're a little bit older, have sometimes had Kaiser, but then also still have a primary care provider at the San Francisco VA. That way, they also are eligible for the cost of medications, which is $5, $8, or $11 for a 30-day supply. And for generic or non-preferred generic, that's when you hit the $5 or $8 for a 30-day supply. And even for a name brand medication, it's $11. So it's a pretty reasonable prescription cost. And then also some folks are also waived from those costs as well. If you are, I think, 50% service connected or more, a former POW, if the medication actually is related to a service connected condition, usually any co-payments, even if you're 0% service connected, would be waived for that condition, including medications as well. Another reason why folks might be waived is if their household income falls below $16,551 per year for a single veteran. And we can go on to the next slide. Wonderful, thank you. So I would say one of my take-home points is that for VA healthcare, it's really important to be persistent. And really, this is for any federal, really local, state benefit, any sort of benefit that you're looking to connect with. It's really important to know, there's some great benefits out there. It can take some time, it can take some effort, but we're happy to do what we can to kind of break it down and help folks if anyone would like to reach out. But it's really important to be your own advocate. I think these are also skills that you've probably also learned in the military, in navigating the systems through the military as well. There's pros and cons of the VA, and one of them is, even the fact that it's a national healthcare system is both a pro and a con. It's a wonderful kind of system to be able to get connected with because you have healthcare across the country, but also it is a large bureaucracy and it can take some time and effort to navigate, but we're also happy to break that down for folks and happy to help however we can. Next slide. Wonderful. So just a brief kind of little overview of our student veteran health program. So I like to say, we're actually one of the vital sites, right? So this is the Veterans Integration to Academic Leadership, as a catchy acronym, but we made our name locally the Student Veteran Health Program because we thought it was a little bit clearer kind of what our program does. But we actually started at City College. I was the first social worker kind of to be the coordinator of that office. office. In August of 2010 was when we opened our doors, and we've been there ever since. And we kind of led the nation in kind of being able to provide VHA services on campuses across the country. So if you are moving across the country, there are different vital sites, and we are kind of the official first one that started. And then when there was a RFP, we were able to apply for a position, which then made mine full-time before being split amongst kind of 3 different clinics. And so we were able to kind of move forward and kind of grow our program starting with that. And so we really love the work that we do. Maybe go on to the next slide. And as far as what we do, we can do a number of different things. So we can do enrollment events we've done virtually, and sometimes we can also do in person at your school. We do, just one-on-one help with enrolling in VA healthcare. We can also help with VA ID cards. Well, we can bring a blue sheet. I've had Dennis hold a blue sheet and then taken a picture of a student veteran. And then we've been able to mail that to folks' address on record, as long as we can verify your identity by some sort of a governmental ID usually. We also do trainings such as these. So we've done these for student veterans. We also do it for faculty and staff. For professional development training and also awareness of veteran issues. We can also help you determine if you're eligible, right, for VA healthcare, or what you might need to do to become eligible, and help schedule medical, mental health appointments as well as others. And we really try to, ease the experience of asking for help, right? That's definitely one of the whole reasons why our program, I would say, is started as well, to try to make it a more accessible program and experience for veterans trying to get connected. And we can also do referrals for campus and community services as well. Next slide. Thank you so much. So now we're kind of getting towards the end here. So we're looking at here, really how do you enroll? So there's a 1010 Easy application for health benefits. You could Google VA Form 1010 Easy, and that should pop up. I think the latest version is maybe April of 2024, if I'm not mistaken. So it's always good to use the latest version if you're able to. We can also email it to you if you'd like. So it would be completing that 1010 Easy along with a copy of your DD-214 documenting your active duty service. And then with that, it's good to make sure you fill out every section if you can. Some folks that process applications are a little bit more stickler than others about things. So if there's a section that's not applicable, just say NA, and then, or draw a circle with a line through it and just go on to the next section. But again, if you would like a little bit more concierge service around kind of the enrollment process, please feel free to reach out to myself and or my colleagues to be able to get assistance with enrolling, appointment scheduling, things like that. There is also the ability to apply online. So the link is there. I feel like sometimes it goes into a little bit of a black hole, whereas we try to track things pretty closely, but you're welcome to apply online or by phone. The Veterans Health Eligibility Center, they call it HEC. That's another way that you can call to help get enrolled, as well as if you need to change your address in the system, that's a really good way to be able to do that. As well as if you go to your local VA, our San Francisco VA's eligibility office is called Member Services, but sometimes they call it the Business Department Eligibility Enrollment Services. Every VA may be a little bit different. All right, next slide, please. Wonderful. Okay, great. So this next slide here is really talking about VA healthcare myth busting. So maybe what we can do, I don't know if Jana or if Dennis is on, maybe what I'll do is do a little bit of back and forth so that you don't hear my voice too much for the course of this time. Jana, do you want to do the myths and I can do the facts?
Oh, sure, if you'd like me to, no problem.
Awesome.
Okay, so myth number one, VA healthcare is only available to veterans who served in combat or have a service-related injury or disability.
Awesome. Yeah. So that's a common myth. We hear this a lot. And so there, a lot of times we'll hear vets say, well, I'm not a combat vet, so I'm not eligible, or I don't have a service connection disability rating, so I'm not eligible. And sometimes this is misinformation they get actually when they're active duty. And sometimes I think this may be people are told this because there's an incentive to get folks maybe connected with the National Guard or reserves, because there is, certainly TRICARE is continued, right? If you're going into those components components. However, it's not true that you need to have that, right? So for example, like I was saying before, the VA healthcare system, right, can provide care to all eligible veterans, and it's regardless of whether you've deployed, it's regardless of whether you have a service connection disability rating. If you have served 2 years active duty, have an honorable discharge, your income is below the threshold, you're eligible. So most most veterans coming out of the military, I find are eligible. So yeah.
Okay. Myth number two, veterans are only eligible for VA healthcare benefits for a limited time.
So that's another one. I think sometimes people think that they are only eligible for whether service connection disability benefits, that they have to apply within a year, or same thing with VA healthcare. I mean, I would recommend enrolling sooner than later, and or applying probably even for service connection disability sooner than later. So for example, if you wait until you're 80 to file for service connection disability for your hearing, they may say, well, how do we know that this is related to your hearing and not just because you're 80, right? So the sooner you do it in some ways, the better. But as far as healthcare in particular, right, your income may go up and you may no longer be eligible. So it's good to enroll while you can. Once you're enrolled, you have it for life, but you do need to enroll in order to be eligible for the benefits. And sometimes the VA can pay for emergency care received outside of the VA if it's a life-threatening situation. But if you don't have VA healthcare, the VA can't cover that. So it's definitely good to apply, especially while your income is lower.
Yeah, that's so important. And yeah, absolutely. Okay, myth number three. I can't reapply because I've already been told I don't qualify due to income or insufficient activity or active duty time.
Absolutely. So this is one of those ones that also is not true. So one of the things that's good to know is that, even if you're denied and you were found ineligible previously, sometimes, circumstances can change, right? So for example, your income could have changed. It could have dropped down. You could have become service connected. You could move, right? So when we were looking at that chart that was showing kind of what the income thresholds are based on area, let's say you were in Fresno and you moved to San Mateo County, right? Or even you moved from, Sacramento to Oakland, perhaps it may actually drop down even, or drop up or down depending. Or let's say you've expanded your family, right? So even if you have an additional dependent, that might actually bump you to a point where you're actually eligible. And so usually you can reapply. I would say typically they want you to reapply, I think, the next calendar year, but it's certainly worth asking, and we can certainly look into it. So if you've applied in 2022, you were found ineligible, you can apply in 2023, you can apply in 2024. If the circumstances have changed, you might not want to do it just for the heck of it unless you know that you're going to become eligible. But absolutely, once you've been told you are not eligible, you can certainly still apply again if you become eligible.
Okay, that makes a really good point. Now, okay, myth number four, you have the healthcare, but if I use the VA healthcare, I will be taking services away from veterans who need the care more than me.
Yeah, so this is something we hear so often from vets, right? I think you guys are generally a very selfless group of people, and there's very much this kind of commitment to caring for other veterans and sometimes putting yourself on the back burner, right? So I think one of the things that's really important in this particular myth is that it actually doesn't work that way. It's actually quite the opposite, right? So VA healthcare is really, not only is it a benefit that you've earned, but when you enroll and use VA healthcare, right, it's telling Congress that it's an important service, and it actually helps to ensure that the VA's budget is appropriately expanded. So it helps to make sure that the VA is able to allocate providers to care for all of the veterans that need care. So really, when you get enrolled and when you're using VA healthcare, you're actually doing, I think, service to your other veterans by being able to actually make sure that enough care is going to be able to be provided, as opposed to like not doing it and just kind of suffering through and just hoping for the best, right? That's kind of a situation where, the budget will shrink and there will be less providers and less veterans are going to be able to have access to that healthcare. The one caveat I would say is that if you do make a VA appointment and you can't make it, if you can cancel it, that is really important because this is one of the things that really contributes to long wait times for veterans, especially for things like intake mental health appointments. It really can make a huge difference. So you want to make sure you're being considerate of your fellow veteran by trying to cancel ahead of time if you're able to. So yeah, and then I think that's about it. The last slide is is my contact information and some additional resources. And if folks want to take a screenshot of that, they can, and I'm happy to answer any questions. I think we're going to maybe save that for the end, but if you put your question in the chat, I'm happy to answer it in the meantime as well, or in the Q&A.
Right. Oh gosh, thank you so much, Bridget. And also, Bridget's contact information will also be on the last slide again. So in case you miss it or need it again, you will see it. And that, Bridget, that was just such great information. And, she really explained, why, like what the benefits are of the VA health coverage and then how to navigate and where to start. So thank you so much for being here, Bridget. We really appreciate that. So another really great resource to veterans and their dependents is Calvet. So that's also what we're here for. And we want to tell you guys some of the different benefits that you can access while living in California. So like I said earlier, my name is Jana Adams, and I am a training coordinator for the California, the Transition Assistance Program team. And I'm at Calvet. So that's different. I'm the State Department. That's different than the federal side. So by living in California, you have access to lots of benefits, and I'd love to tell you all about them. And if you have any more questions or want further detail on them, you can find a lot of our information on our website. And I'm going to tell you where our website is and kind of how to find our benefits. But first, I want to tell you about what CalTAP is. And I don't usually read any of the slides verbatim, but this one is pretty important because the CalTAP team, or the California Transition Assistance Program team, is designed to inform and connect veterans of all eras to their earned state and federal benefits. And we want to make sure that you guys are aware that we're not just here today during this webinar, but we're going to give you guys continued support. We're going to give you all the assistance that you need. If you have questions, if you need help setting up services, if you don't know where to start, we're going to be able to either help you with the benefits that we have, or we'll be able to get you connected to someone that is able to help you. And the way that we really divulge a lot of this information is we break it up into what we call 5 pathways. And we house all this information online in our resource book. I'm going to tell you guys about where to find us online and what the resource book is in a couple minutes. But we have these 5 pathways full of information. We have the core curriculum, which we're going to go over today. It says exactly what your benefits are. We have information on education, employment, and on entrepreneurship, and then also service providers. So our service provider information is actually how to work with veterans, and so that's full of information. So like I said, I'm going to show you where all this info is later, but we do want to let you know that we're going to offer this continued support because we know that the resources and benefits that you guys are in need of today are going to change in 2 years, in 10 years, in 15 years, in 30 years from now. You may need other things because your life is going to change. So kind of what we did is we made this visual aid of all the different things of that you as a veteran and maybe a dependent as well may go through in different stages of your life. And obviously, every person's journey is going to be different, but this is also to kind of plant some seeds of, gosh, I need to sign up for this, or I need to know about this. So it kind of just goes through different stages and gives you ideas of, gosh, what you might be going through and different ways that we at Calvet can help you and support you along the way. And if you wanted to look at this further and in more detail, we'll be able to send you guys the PowerPoint slides. we can actually email them to you if you'd like. Just send us your email address and we can send it right to you. And like I said, all the benefits and resources that we have are on our website, but also in the Veterans Resource Book. And I don't know if you've ever seen this book before, but this is a book that literally lists out all of your benefits and resources that you can access as a veteran or dependent living in California. This book is like gold, you guys. It's really great. They're also free. So if you want access to this book, we do have them available, but it's actually also right on our website. I'm going to show you where it is in just a second. And also, my colleague Michael will probably be putting the link so that way you can download the book and have it right on your desktop or on your phone right now as well. But the best part about this book is on the back. It gives you our 1-800 number, or on the very last page of how you can get a hold of us. And we'll be putting that either in the chat, and also you're going to see that 800 number on the last slide with all of our contact information as well. So this is our website. So you have all the benefits and resources in the resource book that I just showed you. It's also all listed on our website. So when you Google Calvet, we're the first search that's going to pop up. This is the screen you see. If you scroll all the way down, as you can see on the bottom, Veteran Resource Book is circled in red. Click on it there. If you need to find a local county veteran service office because you need to either get that service-connected disability rating established, or if you need to reopen that claim and maybe have that rating raised, that's how you can find them. Or you can just call us and we can give you a number to a local office. Or you can click on CalTAP and you can see all the different benefits and resources that are available to you. So what are those benefits? Well, we offer lots of things. Now, the college tuition fee waiver, that is the benefit that we get the most questions about. This is a benefit directly for the dependents. The veteran is offered the GI Bill when they exit service. So when you're in California, Calvet offers the college tuition fee waiver to all dependents. There are 4 plans. The first 2, A and B, are the most utilized. Plan A states that the veteran is 100% service-connected disability rating. That's already established. And the dependent, they're the ones that need to be the California resident, not the veteran. The veteran can live anywhere. But the dependent must be under the age of 27 and they can have a full-time job, no monetary limitations. Plan B, that's the other one that's most utilized. That one states that the veteran, again, they can live anywhere, but the veteran just needs to have a disability rating established, 0 to 100%, and the dependent must be a California resident. They can be any age, so they can be any age, but there is a monetary limit. They can have a student job, but they can't have a full-time job. So they cannot be making what's considered to be the California poverty level, which is 19,600 or so. So basically they can't make over about 1,100 a month, averaging that out through the year. So if you have more questions on the college tuition fee waiver or how to sign up for it, once your dependent already has a acceptance letter to the school that they want to be attending, then give us a call and we can let you know how to get that all set up and who to contact. If you're a veteran, you can have the veteran designation listed right on your driver's license. Then you don't have to carry your 214 around with you. You do have to get that done by getting your 214 actually looked at by a county veteran service office. We can get you that number if you need to. Now, if you are a veteran who is 100% service-connected disability rated already, and that rating is associated with a mobility issue, then you can sign up and get one of your vehicles, the registration fee waiver, the registration fee completely waived on one of your vehicles, which is really great. If you like the outdoors, we offer reduced fee fishing and hunting licenses, as well as a state parks pass that you can get access to. Now, there is also a disabled veteran property tax exemption that you can access if you have that 100% service-connected disability rating established. And then there is also a disabled veteran business license exemption as well. If you have more questions on this, give us a call. That way we can explain to you about the benefit more. Now, Calvet also has a lot of different divisions that are out and about doing outreach and being able to divulge information to our veterans. In veteran services, that's where the CalTAP team is. That's where I am. We're the outreach team. We are out and about at bases and college campuses and on these webinars. That way we can tell you guys all about the benefits and resources. We have a home loans division, and Michael, my colleague, is going to put our contact. If you guys have any questions at all about our home loans program, you can reach out to somebody directly that works at Calvet. Calvet has their own home loans program, which is different than the VA home loans program. Lots of really great benefits too. So if you are at all considering buying a home, or if maybe you're already in the process, at least check out our program and let us know if you have any questions. Calvet also has a women veterans division and a minority and underrepresented veterans division as well. Both of these divisions offer lots of really great information and resources to these populations, and you can go to the Calvet website, go to their web pages, and you can actually sign up for their roster with your email address so you can get information sent directly to you. If you have questions on how to sign up for that, let us know and we can help you do that. Then there are also 8 long-term care homes here in California, 6 levels of care. All the information is right on our website or in our resource book, or give us a call if you have any questions. They're scattered all over California, and they offer care from independent living all the way up to 24-hour memory care. And then probably something you're not thinking about, but you do have benefits for where you want to be laid to rest at the end of your life. So we have not only national cemeteries in California, but there are also currently 3 state cemeteries here in California, and they're with plans to have a 4th in the LA area. If you have any questions on what those benefits are or want to learn more about that, give us a call, or you can go to our website or look in our Veterans Resource Book. Now, lots of ways to keep in contact with Calvet and with CalTAP specifically. Email us, send us, of course, a non-DoD email address to right here, caltap@calvet.ca.gov. You can register for My Calvet. That's right on the website. Basically asks you lots of questions and then tailors our website to your specific needs. That way you can sign in anytime you come visit us. You can find us on social media. As you can see, our QR codes are right there. We've got Facebook and Instagram. We put lots of our events and things that are going on in California right on the social media platforms. And then we also have our YouTube channel, and that's where we house all of these recorded webinars. So this recording should go up on the YouTube channel probably here in about a week or so. You can attend our webinars. In a little bit, I'll show you a slide with upcoming webinars that you can sign up for and how to sign up for them. You can also take this survey, and we'll have a couple minutes at the end to take the survey, or it will also get sent to you once the Zoom is over. It'll automatically pop up on the screen. All right, well, here's my contact information. You'll see it again at the end of the webinar, so I'm going to turn things over to Kevin, and he's going to talk all about what he does as our local interagency network coordinator in the Bay Area region. Whenever you're ready, Kevin.
Yeah, sorry, I hope I'm not in the dark here.
No,
Hello,
I can see
everybody.
you.
A lot of
Hey.
tremendously good information being disseminated here today. I'm going to briefly go over what my responsibilities are and how I can help you maybe navigate through some of those, through all those different benefits that you heard about. Can I get the next slide, please? Excuse me. So this is a map of the 8 links. We are local interagency network coordinators. It's just a really good acronym to say, really, we are your link to Sacramento, to the entire Calvet system. And so, as you can see, it's split up throughout the state. There's contact information for the different regions. What I would suggest is if you are don't happen to be in that green region, that is the Bay Area, which is 10 counties that I represent, that you contact somebody that's in one of the other regions if you have specific questions about service providers, because they are subject matter experts within their region. I don't know much about what goes on in Mono County. You should get a hold of Merlene down in the red area, and she would help you with that. But I do know a bit about what goes on in the green area because that's my territory, so I can help you navigate things here in the Bay Area. Can I get the next slide, please? So this is what we do. Provide outreach, make referrals. We assist with local emergencies, and this comes into play like when we had the fires and when we had the floods a couple years ago. We'll be at the DRCs or the LACs providing veteran-specific benefits for veterans who may have lost something either in the fire or flood, whether it be a DD-214 or awards or whatever, meds, whatever they might have lost, depending on the how extreme the emergency is. We work together with our big brother at the federal level and provide veteran-specific resources there. And we also advocate upon your behalf, and that's kind of at a local community level. We work with a lot of the local politicians and large business owners and make them aware of the fact that there's a real benefit to having veterans living and working within their community, and they should take advantage of that. Next slide, please. These are some of the ways that we connect you with some of these benefits that are out there. A lot of the things that Janice spoke about and others. And for employment, we rely heavily upon the EDD. They have dedicated employees that will not only help you find a job, but they go out and look for employers that want to hire veterans. So that makes a good partnership that way. And they will walk you through the system. If you are searching for work, find a local EDD office. Actually, it doesn't even have to be a local EDD office, but find one that you can get through to, and tell them you're a veteran, because there are, again, veteran-specific employees there. It takes you to the front of the line, and they'll work with you to help you not only tune up a resume or understand exactly what your appearance should be, but they'll also work with employers that want to hire you. You heard about a lot of our great state benefits. Most all of those benefits are available through your county veteran service office. And I'm going to give a little alibi here right now. I unfortunately was on the road. I kind of popped in the middle of this thing, but I don't think they discussed the county veteran service offices too much. So if I'm redundant, I apologize. But almost all of the benefits that Jana mentioned, because I did hear Jana's wonderful presentation. Oh, my battery's running low. I'll make this quick. Happen through the county veteran service office. As I look for my cord here, they certify the eligibility for a good portion for almost everything that we do, whether it be the college fee waiver, driver's license, eligibility for registration exemption. Those things are all certified by the County Veteran Service Office. 56 out of 58 counties have them. It's legislated that they have them. We help finance them. And they do, since we can't have an office in every county, they do a lot of that heavy lifting for us. They are a very important factor between Bridget up at the federal level, us at the state level, and then the county will help you file those claims and get you involved with the healthcare system also, because they are experts at it. So I encourage you, if you have not, to make connection with your county veteran service office. And then, of course, you heard a lot from what I call our big brother. You heard a lot from the healthcare side of things today, and I don't need to go into that again. But again, the connection there is with the County Veteran Service Office. Next slide, please. That's it. That's me. There's my contact information. I am here to help you navigate through that system. It can be complicated. It can be overwhelming. I would encourage you to be persistent, be tenacious. Keep asking questions until you get the answers that make sense to you. If the first person you talk to doesn't do it, everybody has a bad day. Call somebody else. But we're here to help you. We have a whole team that's willing to do that, and we can't wait to be of assistance. And at this point, I will turn it back over to Jana. Jana, here you go.
All right. Thank you so much, Kevin. And what he said was so true. Like I said, the best part of the resource book, whether you have it in person and it's on the back of it or at the very end of the PDF, is our phone number. And you call that and it really leads to one of our cell phones, whether that's Kevin on the link team, there's 8 of them, or whether it's one of us that are on the other side of the outreach team on the CalTAP team. So please reach out if you guys have questions. So, okay, so just a couple more slides and then we're almost done. So like I said earlier, you can always sign up for more of these virtual workshops. We have a lot of great topics coming up. One more for May, right on Thursday. Dennis, who is a part of Bridget's team, is actually going to be our presenter. And he's going to be talking about improving your mental health. And then lots of other really great topics coming up in June. There's our QR code for Constant Contact. If you use this QR code, then you can sign up for any of our webinars. They're all free. And by signing up on Constant Contact, you'll get the Zoom information. That way you can sign on the day of and have all that information sent to you. Okay, so here is our survey about today's webinar. If we all wouldn't mind just taking out our phones and using this QR code, you guys could take that survey. We really do value your feedback. We want to make these webinars really amazing and really great, like filled with really great information that you guys are going to be able to utilize. And we don't want them, we want them to be great. So if you guys wouldn't mind taking this survey, that'd be great. I'll give you guys just a couple 30 seconds or so to get that QR code all set up. And then we'll go on to some questions. I'm sure Michael is ready. I think there are a few here. So, all right, we'll go move on to the next slide. And like I said, this is all of our contact information for Bridget, Kevin, myself, and also Michael. And we'll go ahead and go over some questions now whenever you're ready.
Okay. Yeah, it looks we had a couple questions coming through. I know that Bridget had answered a couple and I answered one. I'm just gonna read over the ones that we've answered already, just in case those of you that are on have not had a chance to look them over. The first one was just about a disability rating and can somebody with an 80% disability rating receive all their medical care from the VA? And Bridget was able to answer this one. And what she said was, as far as she knows, 80% ratings should be able to receive all the medical care. And with that situation, that was something where she wants to reach out with that individual. Along with any of these questions, if they are personal, we are asking that you do reach out to Bridget on your own time, just because we don't want to have this information out here in public, because it would be public or private. The other question was about long-term care policy. So the last time I checked out the VA long-term care policy, they were not accepting any new applicants until January of 2025. Are there any updates with the program? And again, Bridget, if I'm gonna read what you wrote, but if you would like to jump in and explain or
Oh, sure, absolutely.
expand.
And I'm not 100% sure kind of exactly, because of course I work with student veterans, right? I don't end up doing a lot of work on kind of the elder veteran kind of side and kind of the VA long-term care policy that I think is being referenced. I'm not 100% sure exactly what this particular veteran, I knew who was anonymous, is asking about. So I would definitely recommend, there's a wealth of resources at the San Francisco VA as well as other VAs, but I've got a number of contacts at the San Francisco VA that if I can get a little bit more clarity on the question, if you want to email me directly, I think I did put my email, it's on the screen, but also I emailed the response as well. Or I put it in when I answered the question. You're welcome to email me and I can try to get some more information. Unfortunately, because it's after 4:30, a lot of my colleagues are already gone for the day. So I am unable to kind of get, I think, an active answer for you right in real time. But please feel free to reach out and let me know a little bit about what specifically you're asking about. It looks like I don't know if it's the same person who's also asking about residents into a long-term care home. So I don't know if that's the same question or a different question. I know, Michael, you were asking about that. So that's a little bit more of like a California veterans home, which is different than perhaps some of the local health care through the federal VA, which would be locally in San Francisco or a different VA. So if you want to email myself, I can also reconnect with Michael and we can kind of get those questions answered. But I just would, and again, I apologize because I work mostly with student veterans. It's a little less of my wheelhouse. So I have a little less experience on the long-term care piece. But I do know a number of excellent social workers that do work in those clinics, and I'm more than happy to get some more information.
Yeah, definitely. And if the question comes to us, we will definitely figure out who we could direct you to who can answer that question. So the next question was about our veterans homes. The person basically asked, what are the qualifications for getting into the home? And so qualifications for our veterans homes, there's 8 different homes across the state. They all offer different levels of care. But the veteran does have to be at least 55 years of age or older, or they can be disabled or homeless. With that being said, They also have to choose a home that's going to offer the level of care that they want. So each different home offers something like independent or assisted living, intermediate care, or skilled nursing. So, whether you're going in at 55 years of age or older, or you're going in because of your disability or because you are homeless, you want to make sure that you're picking the house or the home that is going to have the right level of care for you. Um, Another person asked about the driver's license and getting the word veteran printed on the driver's license. You do want to start this process out at your county veteran service office. Bridget posted a link to the county veteran service office website where you can use their location finder. Jana talked about the location finder on our website as well. You'll start off at there. I believe the form is going to be a VSD form 001 or 007, one of those. VSD form 007, I believe. But
Zero,
say it again.
001. You got
Zero,
it.
zero, zero. I was right. Okay. So that form will be found at the CVSOs. They'll certify the document. You'll turn that into the DMV. But yeah, if you have trouble using that location finder on the CVSO's website or on our website, feel free to reach out to Jen or I, and we could definitely help you out with that, or maybe even just give you a direct contact. Can you show the QR code to join the mailing list? Oh yeah, sure. Well, actually, the QR code to join the mailing list is going to be the survey code. So by you completing the survey, we will automatically put you on our mailing list so that you could be connected with CalTAP and the different webinars and service providers we'll be working with over the month. So Jana has that up right now. Will you be emailing the survey link? I'm unable to use the QR code and I'm on the phone. Okay. I can actually, I'll put the survey link into the chat right now. We aren't going to actually, you know what? I'll put the survey link into the chat right now. I apologize.
Michael, it's also going to pop up too, when this Zoom ends, it'll automatically pop up on your screen, whether it's your cell phone or your mobile device or a computer or laptop.
Yeah, you know what? My computer's not letting me do that right now. So with the survey, it will pop up after we close out the webinar. So you will have a chance to take it then. If you still aren't getting a chance to take the survey for whatever reason, feel free to email Jana or myself, and we can either add you to the mailing list or send you the survey link directly. Would also like to know if I could get help with my immigration status. Last time they said they were going to help me out, but they never went through. Lewis, feel free to email me directly, and I'll see if I could get you in touch with our minority and underrepresented veterans division. We'll see how they can help you out. Okay. I brought my 14-year-old son to the States. Getting real dangerous. Yeah, Lewis, just feel free to reach out to me, and we'll see how we can help you out if there's any kind of services we could help. All right. All right. Due to identity theft, is there alternative to sending? Okay. It looks like that might have been the last question.
Oh, yeah. For what it's worth, I think, and I'm not sure if that question was a specific to VA healthcare or not, but I think the question, let me see here, because I answered it, sorry, it disappeared. But I think that it is, yeah, due to identity theft is an ongoing problem, what is an alternative to sending sensitive documents online? So for example, I'm not sure if this person, it's an anonymous attendee, was talking about VA healthcare specifically, but there are a number of different options. So you can apply online. You can also call the Health Eligibility Center. You can also potentially, you can also go in person to your VA medical center. If you wanted to reach out to me directly, I can also help you talk through different options. If you're talking about sending sensitive documents, not as part of getting enrolled in VA healthcare, but another, a different kind of program or benefit, then I'm not as sure, but I do know the VA healthcare side. I could say I can answer those pieces.
Yeah, and if it's stuff like DD Form 214s that are supposed to be submitted to county veteran service offices, Sometimes they have ways that you could submit documents online if that's what you want to do. If not, then you could always just walk them down in person on the same day. They usually do walk-in appointments. I don't think that there's any CVSOs out there that won't do a walk-in appointment. So you should have no problem submitting those documents any other way if you don't feel comfortable.
Absolutely. Yeah, I was just going to say, it looks like the person was saying that it is regarding a DD 214 that they were asking about. So absolutely. If it does happen to be the question around like getting your driver's license, you can certainly go in person to your CVSO. They have usually specific days when they're in person and hours when you can actually go in person with that document. And I would say most benefits are probably similar to that, but if it's a specific one, please feel free to email myself or Michael or Jana, and I'm sure we'll get you an answer to the best way to find an in-person office.
All right, and looks like that was the last question that I see coming up for us. Pretty good question and answer session. So go ahead, Jana, when you're ready.
All right, thank you so much. And thanks to everybody who asked questions, because probably the question that you had, somebody else had that question too. So I'm glad that we were able to get those all answered. And I know this was a lot of amazing information, but it was a lot. So if you would like the PowerPoint slides, feel free to email us and we'll send them directly to you. And also feel free to get back in touch with us and we can go over whatever your questions are directly in the future. So I really want to say thank you to Samuel Merritt for having us and helping us host this amazing webinar today. And then thank you to all of our presenters. Thank you so much, Kevin, for talking about all the great resources that you offer as one of our 8 local interagency network coordinators. And then thank you so much, Bridget, for coming on and talking about all things about, getting started and how to navigate this process, because it just isn't easy. So thank you so much for being available and just being so approachable. So
Absolutely. Thanks so much, Shanna, for having us.
oh yeah, of course. And thank you everybody so much. And if you guys have any questions, reach out, but we hope to see you in the future at other webinars. All right, bye-bye.